Hey there, everyone. My name is Nick St. Fleur. I'm a science reporter with Stat News. I cover issues of health equity, and I have a podcast called Color Code. I'm particularly interested in health tech because, there are some devices like pulse oximeters that don't work as well on black skin and on darkly pigmented skin. So I'm really interested and passionate about equity in health tech. So thank you so much for coming to our health tech showcase. We've got a great lineup of innovative devices today. Some will change the game in accessibility, both in the way we move and how we hear. Another is altering the diagnostic landscape of a disease plaguing millions of Americans. And our teen inventor is treating a problem that affects more than 80% of children here in the US. A reminder that all presenters and their devices will be in the lobby after the show, so you can get a close-up look at these technologies. So let's get started. Up first, we have Connor Landgraf from Echo Health. His smart stethoscope is rapidly changing the pace at which we can detect heart disease.
Thanks, Nick. It's great to be with you all. As Nick said, my name is Connor Landgraf, and I'm the co-founder and CEO of Echo. And today I get the opportunity to demonstrate a really exciting technology that we think is going to revolutionize the way that physicians detect cardiovascular and pulmonary diseases. This is the world's most popular, most ubiquitous, most commonly used medical device on the planet. It helps physicians hear the heart sounds and lung sounds and make critical decisions about whether there is disease present. But it requires an incredibly trained ear to hear the subtle differences between health and disease, to hear the difference between a normal heart sound or clear lungs and a murmur or a crackle. It's not something that is easily gained. It's really a skill set, and in many ways, it's almost a musical ear. And for many providers, if you ask most healthcare providers, they might say that they don't feel confident at using this device, using the most ubiquitous medical device on the planet to accurately hear those subtle signs of disease. And that's a challenge. But the stethoscope remains so ubiquitous, so common because of how fast, how non-invasive, and how accessible it is. At Echo, our focus is on using cutting-edge machine learning and AI technologies to help physicians more confidently understand the differences between healthy and diseased hearts and lungs. We've built the world's largest database of heart sounds, lung sounds, and ECGs that we use to train those machine learning models and give that diagnostic assistance, that analysis capability to providers right at the front lines of care in seconds, helping them have more confidence, have more knowledge about the status of their patients' hearts and lungs. The algorithms themselves are really quite accurate. In some of our most recent real-world clinical deployments, we have more than doubled the sensitivity of primary care physicians when using our AI to help them more accurately detect those cardiovascular conditions. We like to call it Shazam for heartbeats. If you know the app Shazam, it's that same acoustic analysis process. Instead of doing music identification, we're trying to hear those subtle differences in the patient's heart sounds and lung sounds. So today I have the opportunity to demonstrate real, live, here on stage, how this technology works. This is a mannequin here. Obviously, the mannequin is not live, at least last I checked, it's not live. But there's a speaker embedded, which is playing the heart sounds, a real recording of a patient's heart sound. We'll take the digital stethoscope, we'll put it on the mannequin, we'll record it, we'll see the waveform of it on the screen here, we'll send it up to the cloud where the AI algorithm will analyze it in real time and send back down results indicating whether there is disease present or not. And we'll make this happen right here while we're all in the room. So I'm going to stop talking while I do this exam and listen to my very alive friend. So we've recorded the heart sounds. You can see the waveform of the lub-dub of that patient's heart sound. We just sent it to the cloud for analysis, and you can see that the algorithm has come back claiming that there's a structural systolic murmur here in this patient's heart sounds. The patient in this situation had a condition called aortic stenosis. It's a type of structural or valvular heart disease in which there's calcification of the aortic valve, which limits how much blood can be pumped out of the heart during each cardiac cycle. We accurately identified it. In fact, we showed to the provider in the yellow region here where the heart murmur is, where that abnormal sound is, helping them have confidence that this AI algorithm is accurately identifying this disease. And we did so in just seconds, sending it up to the cloud, interpreting it, and giving those results back to the provider in real time. What happens when we can give healthcare professionals at the front lines of care everywhere access to more confidence and more accuracy? Well, we think three big things happen. Number one, we get to deliver better healthcare resource utilization. Patients who don't need to be referred to the cardiologist, who may have a benign heart murmur or don't have any heart murmur at all, we don't have to refer those patients in the first place. But we also get to refer earlier the patients who do have early signs of heart disease. And we've demonstrated that we are quite a bit more accurate than primary care physicians at identifying those early signs of disease. So we deliver better resource utilization and more efficient allocation of critical cardiology and intervention time to those patients who most need it. Number two, we improve access to care. The technology infrastructure, the platform, the capabilities required to deploy this are incredibly limited. A tablet, a smartphone, and the digital stethoscope device. With that, we can give the confidence, the accuracy of a specialist around the neck of a provider almost anywhere on the planet. And then third, we enable more options, more time for interventions. When we can detect that heart disease earlier, that patient has more opportunities for medical management, more opportunity to change lifestyle or to intervene in some other way to ensure that their heart or their lung continues to function healthily in the long term. Or enable the most optimal time for intervention. That patient isn't coming to the cardiologist when they're in severe symptomatic aortic stenosis. We caught that disease earlier, we managed it for longer, and that patient's outcome can be better. We're not stopping there, though. We just started with cardiovascular disease, and we see massive opportunities in pulmonary and respiratory sounds as well. Patients with asthma, COPD, pneumonia, crackles, or ralls, or wheezes, these classic pulmonary signatures that tell us about the function of patients' lungs are just as applicable to be analyzed with machine learning algorithms. And so we see there's tremendous potential to extend this to pulmonary in the long term. We're actively deploying this technology with large health systems in the US and helping them improve the way that they triage, manage, and detect heart disease earlier at the front lines of care. I think in summary, the best way to describe it, as those famous song lyrics say, just listen to your heart. But in this situation, maybe with AI. Thank you.
Wow, that was great. Shazam for the heart. I feel like if I use that, you'd hear a lot of Bruno Mars, to be honest. Okay, so now please welcome Andrea Accardi from Neosensory with a device helping us hear through our wrists.
Thank you. Oh, of course I forgot. I knew I would forget it. Thank you. Hi, everyone. My name is Andrea Accardi, and I work at a company called Neosensory. The company was founded in 2015 by Stanford neuroscientist David Eagleman. And what we do is we build brain-machine interfaces that can create new senses for humans. The idea is to really augment the human experience to help us perceive the world differently. I know sometimes we think we're already taking in a lot, but there's a lot more that goes on in the world that we don't really get to fully experience. And so that's the point of Neosensory. Now, if you'll excuse me just a minute, and our founder has a few words for you, and then I'll resume.
What the brain is really good at doing is taking in information and putting together a story of what's going on out there. But the surprising part is it doesn't care how it gets that information. So we're used to eyes and ears and nose and mouth and fingertips and so on, but it turns out that you can get the information in there a different way and the brain will figure it out. This is what's known as sensory substitution. So in my neuroscience lab, we got interested in this topic of sensory substitution and whether we could do that for people who are deaf. So we built a vest that has vibratory motors on it.
So this is the vest that we built.
And the vest captures sound and turns that into patterns of vibration on the skin of the torso.
Sleep. Work.
And deaf people could get so good at this that they were able to understand spoken words.
Where?
So we ended up shrinking that down over time to a wristband, and it's listening to the world, and then it has vibratory motors all down here. And this is spread in a spectrum so that you're actually feeling the sounds from low to high, which is exactly what your inner ear does. Your inner ear picks up on sounds of the world, breaks it into low to high frequencies, and ships that off to the brain. We're doing the same thing, but we've transferred the inner ear to the skin.
All right, so thanks, David. So that was just a quick introduction, just to give you a sense of, what is our research, what does it look like, and how did we get to this, Fitbit-looking, innocuous, I guess, looking wristband that unlocks a lot of opportunities for us. And so from there, we launched in 2018 with our first algorithm for the wristband. The idea is, of course, there's decades of research in sensory substitution and in enhancing the capability of humans to sense what's beyond our normal senses. But we are in the market today. And if you're interested a little bit more in learning our story and all the tests that we have done before coming to this, it's a very interesting story that David told at TED in 2015. It's available on YouTube. You can find it pretty easily. The question that comes up often is why hearing? There's many senses that we currently have that we could be enhancing, and beyond, there's many new senses that we could be creating. And the short answer is, if you compare, for example, hearing to vision, vision could be expressed as a stream of information that has many gigabytes per second, right? Every second, we're getting so much information. And in fact, our brain devotes such a large part of its processing to vision. By comparison, sound is a pretty simple sense. It's extremely important, but it's in the megabytes per second. And so we can achieve a lot of what you can hear through simple vibrations on the wrist. And so that's why we started to approach the market with hearing. And the first product that we launched is called Sound Awareness, and it's for fully deaf individuals. It's the first solution for fully deaf individuals that is used all across the globe. Deaf users that wear the band can become aware of sounds such as doorbells, alarms, dogs barking, and they get so good at picking up sounds that most of them can actually tell if I'm saying their name versus somebody else's name. So you're really bringing this rich sound environment that we probably all enjoy in our daily lives without thinking much about it. We can bring that experience to them so they can be much, much safer. So safety is the primary concern, and also involved in what's happening around them. We have some partnerships with some employers. Importantly, Amazon employs over 30,000 deaf individuals in their warehouses, and we are on a roadmap to give all of them a wristband so they can be safer when they're operating in their warehouses. So that's something we're very proud of. Our second product.
There's no medical cure for tinnitus, but new research shows there's a device that can help your brain help itself. Introducing Neosensory Buzz, a new device that tackles tinnitus by turning sound into touch through 4 vibratory motors. Research shows that when your brain receives both signals, it rewires itself to reduce the ringing. Use the app for just 10 minutes a day, and you'll hear the difference.
So 2 years ago, we launched Duo, which is our solution for tinnitus, right? Tinnitus is the ringing in the ears, the roughly 15% of the population unfortunately suffers from. I'm sure there's some in the room that have experienced that, at least after going to a rock concert or after being around loud noises. Actually, 3 to 4% of the general population suffers from it so much that it becomes really a problem in their life, right? They can't fall asleep, they hear all this ringing, and above a certain threshold, it can unfortunately lead to enhanced rates of suicidal ideation. It's actually a very problematic condition. We are the only commercially available solution in the world that has peer-reviewed, placebo-controlled science that backs up the efficacy of our tinnitus solution. And it works in a way that you could imagine like a Pavlovian retraining of the brain. So basically what we do is we use the same hardware, we only make one wristband, and we're playing musical tones that are matched by unique vibrations. So you'll hear a melody, right? It goes pa, 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 pa. And each note is matched by a unique vibration, so that with time, the only note that is not validated by a vibration is the phantom sound that you only can hear in your brain. And so that phantom sound, with time, becomes deprioritized by your brain. And so in only 6 to 8 weeks, we have a 94% success rate, which is absolutely extraordinary. We're very proud. We are the #1 solution for tinnitus in the United States today, and we hope to launch in other markets very, very soon. Finally, sorry, I should have moved back to this. This is some more information about Duo. Finally, our last algorithm, again, same wristband, it's called Clarify. And what the band does, it's still listening to sounds, but it's actually isolating human speech, and then is representing particular phonemes, which are difficult parts of speech, with unique vibrations again. And so effectively, the wristband becomes an alternative to hearing aids, right? Because our hearing with age tends to decrease, right? Everybody loses their hearing. We are born with roughly 20 to 20,000 hertz for those of us that have normal hearing at birth. And then with time, I tested mine, I'm like at 16,000, but then it starts to creep down, and so you'll stop hearing the voice of children first, because kids have a very high-pitched voice. And then with time, you'll keep losing and losing. You then lose the voice of women, and then the voice of men, which is why 80% of people that report hearing loss are men. That's not based on biology. That's just based on the fact that most men can't hear their wives as well as their wives can hear their husband. And we can debate whether that's good or bad in a wedding, but the reality of it beyond the marriage situation is that it is a big problem, and everybody faces it. There's no escaping it. But the band can really become a perfect ear on your wrist. What happens is pretty interesting. It does take a couple of weeks for people to get used to the vibrations and understand that actually they are hearing through their skin. But there's the aha moment where people stop feeling the vibration and they just start hearing through their skin. So you can't notice the vibrations anymore, which is the same that's happening right now. If I'm talking, madam, you're listening to me. What I'm doing actually is I'm making your eardrums vibrate, right? But you don't feel your eardrums moving. You hear my voice as if it's coming from my mouth, right? But it's not. What's actually happening is just your eardrums are buzzing, and our brain is really plastic and is really good at making sense of information, no matter where it comes from and no matter what pathway it's using. As long as there's meaning associated with information, the brain is really used at making sense of that. And I'll just close with a few. We have a lot of science. I promise. It's all good. Our founder is at Stanford, but please come and ask me about our science. We'll be in the lobby later. We have a few products in the pipeline. I'm almost out of time, but I'm very excited about the Balance initiative. The band can tell when you're tilting, and then it's going to pull you up in the right direction. We have a stuttering algorithm. We're testing those at Stanford. We have algorithms for the military to protect our armed forces from friendly fire, jet fighter pilots, drone pilots, surgery. And finally, one last example is, because we have an open API for the band, over 70 teams have already developed applications for specific uses. And one that is just closed their seed funding is Valence Vibrations. And what they're doing is they're using the band to listen to speech, but rather than help with hearing loss, they're actually helping kids with autism. So the band will listen to the tone of the voice of the person speaking to you, but it's going to respond based on their emotional state. If I'm angry, the band will pass aggressively. If I'm happy, if I'm sad, all the emotions can be represented by vibrations, and that can really help kids with autism socialize because they can interpret the emotions of the person in front of them. Now, this is still being developed, and we are running clinical trials, and we are supporting Chloe at Valence. She's a dear friend of the company, and we work very closely, but it's just something that we know is going to make a big difference in the lives of many, many people. Sorry for being over time. Thank you so much. I'll be outside later. Thank you.
Wonderful. Thank you, Andrea. You definitely gave the husbands in the audience some, some good excuses there. I'm sure they were taking notes. So next up, we have Garrett Brown from Exokinetics. Zooming in on the next great thing in mobility, the Zeen is what you get when you combine a walker and a wheelchair.
Thank you. Thank you so much. I have a story for you about two inventions. One happened 50 years ago, and I immodestly must say it revolutionized, as it's been said that it revolutionized the way films are shot. And I feel so fortunate that anybody would say that, but I will tell you a bit about that. I was a little film company in Philly. I was making the early movies for Sesame Street and commercials, and I loved the moving camera. And I had a dolly, because that's how you moved a camera smoothly. I had an 800-pound dolly for my 12-pound camera. And the pin-headedness of this was a torment to me. But worse, even dollies are mechanical and soulless in their way. And I loved the agility of human ambulation and the reach that we have. And I wanted a handheld camera to be smooth. And I undertook to disconnect the camera from the camera person. This is my first try, which was not a success. I wanted to call it the Brown stabilizer because I wanted to have my name on it. And it was clumsy and big and heavy, but it worked. And it knocked them dead in Hollywood when I took my demo film out to show companies that made movies. This is, after a week in a motel, a design for something that would actually work in 35 millimeter for feature films that would be stable, light, and practical. And that it just fired me into the movie business. We made that demo over again in 35 millimeter. You may recognize those steps. That's the Philadelphia Art Museum. I ended up months later chasing Stallone up those steps with this invention. And I ended up on 100 films. I had a marvelous time. And I had an enduring affection for the idea of inventing. And I feel in such wonderful company here. My jaw is hanging open at what my colleagues here have done. And that is the hope of humanity. The fix that we've gotten ourselves in, I think we're not going to fix politically. I think we're going to have to fix it inventively. So I had a grand time, and fast forward, lots of movies. And that was 100 patents earlier. And I have enormous affection for that first invention and for the one that I'm about to show you here. This is my dad, Rodney G. Brown, actually invented something very valuable for DuPont. As he was declining, I spent weeks with him, and I looked at his pals on walkers and wheelchairs. I'm not a clinician, you know, I'm just a persistent somebody who's somewhat empathetic and very alert. And I decided to try to do something about that because there's a giant thing missing between walkers and wheelchairs. Walkers are a little slow, a little dangerous. I actually watched a poor guy fall backwards from his walker. They're in your way, and they are not great for your shoulders. Wheelchairs have been called a one-way ticket to not walking. So I started thinking what might be possible to get somebody a chair, for example, that was comfortable, that did the lifting, because I watched my dad's pals struggle to get up from chairs, and that allowed you to perch up high in bar stool mode so you're up among your fellow humans, and then that became an elegant fast way to get around and a safe way that will help with fall prevention. I took the wheels off a bicycle, loved that. Obviously not appropriate for, people that are challenged for mobility. And I solved the lifting problem more or less the way it worked with the Steadicam, which was lifting 70 pounds with your fingers. And we are now undertaking to lift 250 pounds. We did a wonderful job of inventing and designing this thing, and it is one of the most elegant objects in the world. And here it is. I'm kidding. That's not it. Here was my first try. It does the lifting. It's a chair. It lifts you up with a saddle. It allows you to coast and walk. And this is what it turned into.
Garrett Brown. We met him about 5 years ago on assignment for Sunday morning in the throes of retirement. But now he's back with a new invention, hoping to rock a new wave of mobility for those who don't have it. He calls his latest invention the Zeen.
Something big seemed to me missing between walkers and wheelchairs. You're not upright. Being upright is great for your cardiac, your bone density, and it's particularly valuable for your psychological well-being. To be up among your fellow humans is one of the things we hear most often that they love about this machine. What is it that we need? We need a comfortable chair. We need to not have to ditch that chair to get moving. But hey, let's get to your feet without the whine of motors, and let's get to your feet like a kid.
He began marketing them at healthcare conventions, anywhere he could reach people with limited mobility.
Every day I got better. Every day I got stronger. Because whenever I'm in the Zeen, I feel so much safer.
The Zeen has helped me enormously, and the Zeen helps with going long distances. I found for me as a life amplifying device.
Autonomy, and that's an important word with this. When you're in it and you're safe, you're on your own.
Like his most famous invention, this new one is here to help.
Yeah. And here it is. We've been on the market for a year. We've sold 330 of these. The results have been astonishingly, wonderfully great. It is a comfy chair. It does the lifting. It gets you up to bar stool mode. Not quite high enough for me. I'm 6'6", and I had to make the awful choice to make it, for the average run of humans up to 6'4". So it is appropriate for people from 4'11" to 6'4", unfortunately, and from 90 pounds of weight to 250. And you can adjust its lift in 5 ranges, 30 pounds apart, from 90 pounds, and it will lift something over 200. And you can lift yourself up like a kid, silently, as fast as you want, You can stop anywhere in between. You're not socially sitting at navel height with your head. You're instantly up at any height you want. It has a pair of somebody's been looking at my device. Hang on. It has a pair of handlebars, right? And once your feet are on the ground, you can walk with your seatbelt, which we've civilized greatly. And you can also coast. And coasting is wonderful because you can really cover the ground. It's quite agile. Almost no energy is involved in getting, halfway across a mall with the handlebars out of the way and the seatbelt slightly tightened. You can cook. There's nothing in your way. You can put your shoes on. You can do lifestyle stuff. So we're talking to investors. We're going to scale up for mass production. It's been terribly exciting, the results mainly. And COVID was very kind to us. COVID gave us a year with 3 engineers working on this and pretty close to perfection. Every invention of mine has been dragged out of the nest screaming and put to work. This one was quite ready to go to work. And I would be delighted to show it to you when we get back after the show. So thank you very much. I'll stow this baby here and I'll get it later.
Thank you so much, Garrett. That was really insightful. I'm all about accessibility and equity in health tech, so thank you for sharing that. And now, last but certainly not least, America's top young scientist, Leanne Fan, is here with her invention, the Finsen headphones. She's aiming to treat ear infections by doing something most of us do daily already: wear headphones.
Hi, I'm Leanne Fan. I'm a rising sophomore, and I'm from San Diego, California. So last year, I won the 3M Young Scientist Challenge. It's a challenge where kids from around the US can submit their science projects, and the top 10 go to the 3M headquarters to compete for the title of America's Top Young Scientist, $25,000. And I also had the wonderful opportunity to ring the New York Stock Exchange opening bell. So today I'm going to talk about the invention that got me there and also my future plans. So I first came up with this idea because my mom always gets ear infections. And whenever she gets these ear infections, she asks me to put a few drops of garlic oil into her ears. And as a 5th grader, I thought this was really weird. I also didn't think it would work, and turns out it didn't work for her. So she still had to go to the doctor's office and get a round of antibiotics. Back then, I thought ear infections weren't a huge problem and they were just kind of a nuisance, but I learned that this really wasn't the case. So the WHO states that by 2050, 1 in 4 people will have hearing loss to some extent, and the majority of this will be caused by mid-ear infections. Furthermore, these are more common in children than adults, and children are less likely to take antibiotics. And the way I made this is to make it easier for children to wear. So I wanted to make it accessible for people. I also wanted to make it low cost, so price isn't an issue, because half of our world's population doesn't have access to healthcare. So the first thing I need to do is find out, how can I detect ear infections? Well, when you go to a doctor's office, you get your ear infection detected using an otoscope or using tympanometry. However, these both require doctors, and tympanometry requires a huge, expensive machine. So I did some research, and I started out using image machine learning. And this is my second prototype of my Finsen headphones. And it works because I take a picture of your eardrum, and I put it into my machine learning model. When it classifies it, and it tells you whether or not you have an ear infection. But I found there are a few problems. The biggest one is that a lot of people have earwax in their ear. And this would block the camera, and you couldn't get a good picture of the eardrum. So I had to look for a new solution. My third prototype of my Finsen headphones, I use acoustic reflectometry. And this is a method of ear infection diagnosis where you use sound to detect ear infections. And the way this works is when you have an ear infection, your mid-ear fills with fluid, and this causes your eardrum to bulge and become stiffer. This means that when you send a sound into your ear canal, it's going to bounce back differently depending on whether or not you have an ear infection. So using this method, I sent 2 silicon chirps into an ear canal model. And I had to use a model instead of a real human ear canal because I didn't have access to hundreds of patients with ear infections. So what I did is I gathered around 1,000 of these echo sounds. I classified them, and I turned them into spectrograms, which is like a picture of sound, because I'm using a convolutional neural network to detect ear infections, and these require image formats, not audio formats. I was able to get an 80% accuracy rate using transfer learning using these headphones, and I can compare this to using an otoscope, which has an accuracy of around 70%. So the next problem I needed to solve is, how can I treat mid-ear infections? So like my mom, a lot of people get antibiotics to treat ear infections. But I found that antibiotics have a few problems as well. The first one is that 60% of ear infections are caused by viruses. So in these cases, antibiotics would be ineffective. And the second problem is that we have a huge antibiotic resistance problem. So we really should reduce the overuse and misuse of antibiotics. So I learned about Niels Finsen. Does anyone know who Niels Finsen is? No one? Okay, well, he actually won the Nobel Prize in 1903 for inventing phototherapy. And phototherapy is the use of light to treat disease. So he invented his Finsen lamp, which uses UV light to treat skin tuberculosis. However, this invention was overshadowed by the ease of use, the effectiveness, and how cheap antibiotics were. So I wanted to bring back this century-old invention in my Finsen headphones, which are named after Niels Finsen. I'm using a 405 nanometer blue LED to kill bacteria in your eardrum. And the reason this works is because blue light is near the UV spectrum. However, it's still an invisible light spectrum, so it doesn't cause any damage to our cells, but can still kill bacteria. And I proved its antibacterial properties through 2 antibacterial property tests. The first one was using a disk diffusion test through Petri plates, and I found that blue light could kill bacteria on a surface from 45 to 75 minutes, and most effectively at 75 minutes. And the second test I did was in a bacterial suspension, which is kind of like the mid-ear fluid in your ear. And I found that the tube that I exposed to blue light had a 20% decrease in bacterial growth. So now that I had both my detection and my treatment methods, I needed to find a way to make it easy for children to use. So I put them into a pair of headphones. These headphones are noise canceling, and I partnered with the 3M in the 3M Young Scientist Challenge to obtain these headphones. And the reason I use noise-canceling headphones is because my detection is based on audio. So any outside background noise would affect the accuracy. These headphones cost around $70 for me to make, which is compared to the cost of going to a doctor's office and getting a round of antibiotics, which if you don't have insurance can cost up to $380. And finally, I'm not stopping there. I'm planning to make my 4th prototype of my Finsen headphones, and there's a lot I want to do. So the first thing is I want to decrease my treatment time from around an hour to less than 6 minutes by manipulating the way that I use the blue light. Next, I'd like to be able to train my machine learning model on actual human eardrums so that these can detect ear infections in people and not just ear canal models. So finally, in the future, I'd really like to I have so many plans. I want to shrink these headphones into a pair of wireless earbuds so that we can continuously assess the condition of your eardrum for people who are predisposed to having ear infections so that we can prevent these infections from getting worse using the blue light and send this information back to your doctor so that if you need extra treatment, you can get that treatment. This way, we can reduce hearing loss and before it happens, especially in children. Remember that 60% of hearing loss in children can be prevented through early management and detection of ear infections. So I really hope that my invention can reduce hearing loss as much as possible. Thank you.
So now we're going to have some Q&A. So I invite all 4 of our panelists to come right back up. And as they're coming back up, can we actually get another round of applause for all 4 of them? How amazing were those ideas? Simply incredible. So there will be a couple of mic runners going around. If you have a question, raise your hand high so that we can have it asked. Okay, questions? Yeah. Okay, right over here, gentleman in the blue shirt.
I'm Bob Wales, also from San Diego, by the way. And a couple questions, just really quick. The first presentation with the EKG and the phonics and all, can that be directly imported into your electronic medical records? I'm a physician, so that would be really handy. And then the second question is for the wheelchair, how much does it cost?
You want to go first?
Sure. Connor? Yeah, we have an integration with Epic, one of the EMR vendors, so we can attach the heart sounds or lung sounds to the patient record. Still a little bit cumbersome there, but we're making the heart sounds part of the patient record.
And Garrett?
$39.50.
$39.50. Great.
Lira.
We have more questions. We have the woman in the back there. Can someone get a microphone to her? We got a microphone coming.
What,
1 second. We got both of them. Tie. Go right ahead.
Regarding the Zeen is really amazing. I wondered if you thought about it for post-surgical complications. So that's an issue for any sort of orthopedic procedure or any sort of surgery. When a patient's immobilized, they get a lot of complications, either surgically or from blood clots, things like that. And there's a huge amount of spending that goes with that. And I imagine it's much, much more than $39.50 lira.
I think I understood your question. I'm not a clinician, obviously. Our team has a wonderful PT doctor, and they're all at Abilities Expo in Chicago this weekend, where they are typically rock stars. But I would punt that question to somebody that really knows the answer. I do believe that staying in motion and being able to use your musculature, and as many people that have tried the Zeen say, having their feet on the ground instead of on a motorized wheelchair is terribly important. So I think it's indisputable that staying active is useful. And the joy of life that comes from being able to tool around, as we used to say, is not to be dismissed. That's important, you know. Was that anything close to an answer to what you asked? I have the husband disease, and I can only hear a giant clam now. So,
More questions. This gentleman over here in the hat.
I have a question for Echo Health. How have you monetized the product? Part of me thinks I'd give this away to every physician and charge them a few dollars for each interpretation, but your turn.
Yeah, good guess. We provide the devices to individual clinicians. They can purchase it. It's a little bit more expensive than a traditional stethoscope, but not substantially more. And then we work with large health systems to deploy the AI models on a subscription basis. But you could think of it as like free software for individual docs, and then when we partner with health systems, there's a subscription fee.
Great. More questions? Okay. Right over there in the purple shirt.
For the gentleman with the wristband device, tinnitus is a #1 disability among veterans. Have you discussed anything with the VA?
We have, yeah, that's a great question. Yeah, tinnitus has like a 75 to almost 80% prevalence with veterans, and it's the #1. #2 is hearing loss. So we have a solution that works for both. We have two trials lined up with 2 VA locations. It's not easy, I have to say. It's actually been, causing me a lot of sleep loss. Maybe somebody has a solution for that. But we definitely work a lot with that population because the exposure to loud noises is tremendous, and unfortunately, hearing protection is not always used as intended. Plus, with the 3M problem, yeah. So we definitely work with that population. Yeah.
Great. We have time for more questions. Right over there, woman in the black.
Thanks. I have a question for Zeen. How much force does it take to initiate going from sitting to standing?
How much, sorry?
Force does it take to initiate going from sitting to standing?
You can adjust it so there's zero force and you're literally in zero gravity. But it's generally preferable that you exert a little bit of force. For example, we rate it up to 250 pounds. It will lift up to 210. And that 40 pounds just seems like nothing. And you can use your hands as well as your legs.
Has it been used in TBI patients? Have you tested any brain injury patients?
Sorry?
Have you tested any brain injury patients?
We have tested stroke rehab is a valuable use for it. And it's been valuable to help people, recover from stroke. That's the only brain injury that I'm aware of that we've tested so far.
Okay, thank you very much.
But remember that you are supported by the saddle and you have a seatbelt. So whatever force you can generate upward, it will not likely make you fall or teeter or and so on. I have a shocking demo where I leaned forward entirely from it, and it's fine. And of course you can't fall backwards.
Great. More questions. This gentleman over here near the front.
Question about the ear infection technology. Could that be put into typical earbuds where, you're sort of preventing ear infections in individuals all along, or would there be a downside to sort of AirPods that had a feature for treating ear infections if your ear was hurting? Or do you see that in the future?
Yeah, I would, but I would say it's more of a not 24/7 prevention. It would just be for a few hours a day. And the reason is because blue light is still near the UV spectrum, so it still could potentially have some damage to our cells, but that would still take more testing, but it would work, just not all day.
Great. We have time for a few more right there in the back. Gentleman over there.
Yeah, my question is for Neosensory. Have you looked at potentially a role in mental health? There's a lot going on with, neurofeedback using magnetic stimulation, other forms. Have you looked at your wristband solution potentially for things like depression and anxiety disorder?
Thank you. It's a great question. Yeah, the only actionable trial that we have right now was the one with autism that we are currently undergoing. So that is really, really promising. Other than that, we haven't yet expanded into that. But I know it's a super exciting field, and I do believe that there can be potential avenues there in the future for us. Right now, it's only autism, though. Yeah.
Great. Thank you. Some more questions. I saw some hands right over there. Thank you so much.
Thank you. I love all of these inventions. They're awesome. I have a question for Echo and for Neosensory. You mentioned that you have the largest database of heart sounds. How big is it, and what population source did those heart sounds come from? Yeah. And also, are you expanding the database as you work with the health systems?
Good question. So yes, the data set is built off of clinicians using our software. All of the software is cloud-based, and so the recordings from those patient heart sounds are sent to our cloud data set, and we can use those in a de-identified fashion for the algorithm training purposes. It's in the millions now, and the benefit of that is that it's real-world data. It's not clinical trial data. It's done in a noisy emergency room with the child screaming in the background with the air conditioner on. It's not in some sort of kind of perfect clinical study environment. And so we find that actually makes the algorithms perform much better when they're trained off of real-life data sets.
And
it is actively growing.
And the patient population is adequately diverse. So, I'm thinking in terms of not just SDOH, but also body mass, extremely fit, extremely unfit.
Yeah.
That's all in there.
We've been making pretty concerted efforts to do data collection both in the US and outside the US, making sure that we have as wide a demographic pool as possible. And I think the question is, there's no way to avoid bias. It's just how can you minimize it as much as possible? I don't think it's really humanly possible to have an absolutely perfect data set, but how can you make it as robust as possible? And then run the data validation to prove that, hey, there isn't significant performance gaps between demographics or patient profiles.
Excellent, thank you. And then for Neosensory, could you describe a little bit more about your cost model and also the training model? Like, do people have to go to your site for those 4 to 6 weeks? Can you just describe that a little more?
For sure. So we currently are on the market, and the band costs $1,000. However, you can also rent it. And we wanted to do that mostly because of accessibility, even though it's a gigantic pain to track bands coming back and forward. It's a mess. But you can rent it for $250 a month, and that's really helpful for people with tinnitus because they get a flare-up, they rent it for a month or two, they do the training every day, and then they return it to us. So it's more affordable in that way. So that's more or less the model. Then we also have a distribution channel through audiologists, clinics, ENTs, hospitals, and then partnerships with employers. So that's pretty much where we are. I'm sorry, the second part of the question.
Do they have to go to your site?
Oh, no, sorry, you're right, the training. So we developed an app that you use to pair the band. Then you use the app to basically tell the band what to do, in what mode to be in. And then the app can guide you through these training exercises, right? So it's going to show you a video of a dog barking, and then it's going to make the sound of a dog, right, on your wrist. So for deaf individuals, the training is really helpful because it helps them identify sounds very clearly. For tinnitus, the app is actually essential because the app is what plays the tones that then are matched by vibrations. But for the hearing loss, we actually don't need the app at all. The band, in fact, always ships in clarify mode, in hearing loss mode, so that older individuals that maybe don't have a smartphone or not super comfortable in using it, they can just get the band, they put on the wrist, and then the only thing they need to do is be around speech. And the band will buzz, and they're normally looking at the person speaking to them, and they're getting 3D vision, is what they tell us. So they're combining whatever hearing they still have with vision, lip reading, and the vibrations. And then you're really reducing the standard deviation of your guesswork. Every extra input gets you closer to the perfect guess, right? And so that's working pretty fine. So no, we don't host any training. It's all on the app when necessary, but sometimes it's not even necessary.
Great. I have one last quick question for Leanne. So Leanne, does your mom use the headphone? Does she use the headphones now, and does she like to use them?
No, she does not, because the weird thing is, right after I made my headphones, she magically stopped having ear infections.
I guess that means they work. Yeah. Well, thank you to our 4 panelists for their demonstrations today, and to all of you for joining us. And I invite all of you to the lobby where you can meet up with our panelists and their devices to learn more, ask questions, and get more hands-on with the technology. One more time, a round of applause. Thank you all so much. They'll be right there in the back.